Hi, my name is Rosie Ron Hoàng Mei, and my ID is 107-402-85. Today I will talk about the way we use the machine learning and cloud computing to predict the growth and trend of COVID-19. So first of all, let's jump to the outline. The first part, I will talk about the prediction model and performance comparison. In the second part, I will talk about discussion on the results, bias, implementation, and possible deviation in the future. In the second part, I will talk about research and opportunities and emerging trends. And in the last one, I will talk about conclusions and future research opportunity. Let's come to the first part. So before we talk about the prediction model and performance comparison, I will introduce some the reason why I choose this journal. Because the journal is released on the May of 2020, so as you know that as some data from the WHO, as on 4 May of 2020, a total of 3,581,884 confirmed positive cases have been reported, leading to 248,558 deaths. So we all know about the major cause leading to the COVID-19 and the consequence. So I will not talk about this, but because the situation is getting worse, so there is a need for innovative solution to develop, manage, and analyze big data on the growing network of infected subjects, patient details, the community movements, and integrate with clinical trials and for the public health data. So we all know that there are some sources of data, including text messages, online communication, social media, and web article can be very helpful in analyzing the growth of infection with community behaviors. So we can use all this kind of data by we graph all of this data and use this with the machine learning or artificial intelligence, and we can forecast the where and when the disease is likely to spread, and we notify those regions to match the required arrangement. Travel history of infected subject can be tracked automatically, and we can know the how worse the situation can be to have some method to prevent it. So from the prediction model and performance comparison, the data set is withdrawn from the data set used, which named the hour in data by Hannah Riches 2. And the data set is updated daily from the World Health Organization situation reports. And the source you can hear from here, our in data organization coronavirus source data. So next, I will talk about cloud framework. You can see in the picture we have cloud enterprise, including artificial intelligence analytics, prediction engine, COVID database, and the user is including patient, gateway device, private hospital, and government centers. So there's some notification for the cloud framework. The data used including positive patient count, population density, average and median age, weather condition, health facilities. And we need to note that there are some inadequate data from some region. Entry assistant of single virtual machines from the Microsoft Windows Server 2016. and health fork framework, leveraging their focus. And one more thing is the cost for this is just 1.2 USD per day. And as the dataset size increase, the more powerful resource computationally would be needed. It's about cloud framework. How about the machine learning model? I need to say first, like in the previous journal, they in this journal they will compare the two kind of method. The first one is Gaussian GUOSSIAN baseline method, and the second one is generalized inverse Weibull distribution. And let's see which one is more effective. So in the machine learning model, we have this one. The first one is the equation. So you can look at the equation, then fx denotes the number of cases with x, where x is more than 0 is the time in number of days from the first case. Alpha, beta, gamma is more than 0 belong to real numbers, which are parameters of the model. Now we can find the appropriate values of parameters alpha, beta, gamma to minimize the error between the predicted case and the actual case. You can see you can see fx equal y is the predicted case, and and another one is the actual case. So this can be done using popular machine learning technique of for the curving fitting. So you can see from here. And next is the main idea is follows according to the machine learning model. You can look at the picture. The first one is about the data for COVID-19 for Hong Kong from the World Health Organization. So you can see that first, we fit the curve using the learning machine technique with weighted of all data points as 1, and then first wi equal 1. Second, we find the weight corresponding to every point for the next integration, w with the n plus 1. So yeah, basically this one is equation on the right-handed side. It's above my knowledge, to be honest, because I didn't learn about the machine learning model, so I'm trying to understand it. So simply in the above equation, we first take the time string function defined as time string x equal x minus time x for the distance of all points along y-axis from the curve. So we have higher value for point far from the curve and near 0 value for the closer point. Standardized by dividing with max value over all points and subtracted from the 1 to get weight corresponding to each point. So yes, you can see this weight is when standardized using so FT max function. So sum of all weight is 1. So next is analysis and interpretation. So you can see thus we talk about the second model, the one which is shown that is more effective. So as shown in the figure 4 here, we can see that the prediction of baseline Gaussian model deployed by the SUTD are over optimistic. You can see here the light Gaussian prediction, the green one, is too optimistic and could lead to the premature uplifting of lockdown. So when they look at the prediction of this method, Gaussian prediction, they will unlock down earlier, so it lead to some severe results. causing more effect on management of epidemics. So having better fit models could have planned better strategy based on more accurate prediction and future scenarios. So you can see here is the figure 4 explained in model section. The FIS curve can be used to predict the number of cases that will have to be dealt by the country. So the figure illustrates the maximum number of total cases will be in North American region. The number of cases will also be high in European continent, Russia, Eastern Asia, include China, the original epicenter of disease. So the other one on the below part is you can see, and the below part on the left hand side is number of new cases and deal with all by country. Show that curve corresponding to both new case and death across the world. Using the predicted total deaths, the expected death rate can be calculated by 100 times predicted total deaths over predicted total case. So it's there are some countries that have the predicted death rates is lower than other country. You can see in the below part, the right-handed finger. So about the result and discussion, you can see as there are a lot of countries which is mentioned in their journal, but I just mentioned some of them. Like you can see basically on the Germany and France, you can see here the robust wearable prediction and the Gaussian prediction. Both of them can almost predict their data, which is really close to the actual data, but the robust wearable prediction is much closer to the actual data. So we have the right look onto the scenario of how worse the pandemic is. So we have for example, look at the Germany. We can see that the prediction data and actual data is reached the peak on the March of 30. So actually, it's not really on exactly which day, but we know the period of time. On the France also, we have on the March of 30 in March. Yeah, you can see. And it's even exactly which day in France. Yeah, on 29 May 2020, 97% of total predicted case. So we can see very close. So after they use the machine learning to predict the growth or trend of COVID-19 pandemics, we can see that we have a lot of opportunity in the future and emerging trends. So the first one is risk assessment. The risk of severe disease related to COVID-19 for people with different age can be predicted using artificial intelligence. So we can know that we can prevent the virus spreading very fast to some sensitive group of society. The second one is contactless treatment and drug delivery using robotics. Artificial intelligence based robots can be used to perform contactless delivery like Uber or Food Panda and treat patients remotely to reduce the involvement of medical staff with infected people. Further, there have been considerable improvement in air quality across the globe due to the COVID-19 enforced lockdown, like really some country like China or some other country from all the big city around the world have the really bad air quality So, and the next one is predicting protein structure of COVID-19 too. So AL also can be used to predict the structure or function of various proteins associated with COVID-19, COVID-2, and their interaction with the host human protein and cellular environment, the contribution of various social economic variables that determine their vulnerability, spread, and progression of an epidemic can be predicted by developing suitable program. So it helps us to decide resource allocation in large country with limited healthcare resource. And next one is incorporating other indicators, important parameters like population density, distribution of each individual and community movement, level of healthcare facilities, available strain type, virulence of virus need to be included in regression model to further enhance the prediction accuracy. And on the other side is climate change. Climate change, there have been considerable improvement in equality across the globe during COVID-19 lockdown. So, however, some more, we need more extensive study to see more which area and age distribution with other characteristics can be studied in the future. Next is analyzing social media data using AL. We have we also explore and analyze social media data for real-time collection of epidemic mycological data related to COVID-19. The last one and the next one in integrating with other time series model. We have so we can see that model like other model also can have their need more time to analyze and predict. Real-time sensors and visual imaging. So, which is about the AI-based proactive measure can be taken to prevent the spread of virus to sensitive groups in society. Real-time sensor can be used, for example, in traffic camera or to track the COVID-19 symptoms based on the visual imaging or tracking apps inform respective hospital and other hospital. Checking needs to cover all stages or parts of entries like public place and hospital. So about the conclusion, we can see that machine learning and cloud computing can help to predict the growth of the epidemic proactively. It's very useful in the future, and you can see it predict like 97%, even can predict the peak of the pandemic. The worst scenario can happen. And using the proposed robust global model based on iterative weighting, we show that our model is able to predict better than the baseline one, which show the scenario is too optimistic. So we can prevent the pandemic and we can have more better strategy based on the robust global model based on that model. Like we can unlock that early or later, or what kind of time which is more suitable to economy development, like that. So thank you for listening. If you have any questions, please read more the research and ask me. But to be honest, the research is really good, knowledgeable, but I don't have that much knowledge in this machine learning, so I cannot cover everything in the presentation. Thank you.